Okay, for my part, I would like to add on and support Brittany's claim. So for significance, I like to say that euthanasia is ethical and shows respect to patients. Robert Young, a member of the Faculty of Humanities and Social Sciences at La Trobe University in Victoria, Australia, says that the central ethical argument for voluntary euthanasia is directly connected with competence because autonomy presupposes competence. If a person is competent in decision-making, it is disrespectful to deny them the competent choice they have made. A competent person knows what is best for themselves, and that is why screening tests and interviews of competence need to be done in order to make sure the person is not making the wrong choice. He also says, the patient's judgment of whether continued life is a benefit must carry the greatest weight, provided that the patient is competent. So respecting a competent person's autonomous decision to end their life early is ethical and right. So another claim I'd like to make is euthanasia promotes the idea of autonomy. So choosing time, place, and method of death provides terminally ill people control over the final moments of their lives. Robert Young, as I mentioned earlier, also says that in exercising autonomy or self-determination, people take responsibility for their lives. And since dying is a part of life, choices about the manner of their dying and the timing of their death are, for many people, part of what is involved in taking responsibility for their lives. So people taking responsibility of their own lives expresses autonomy, and euthanasia is the way people can take responsibility for their lives. And another claim is euthanasia would reduce the amount of fear and terror in patients, because people will do drastic things out of desperation, and fear usually leads to suicide, and most suicides done by terminally ill patients are unexpected and usually messy. And euthanasia allows a more peaceful, controlled, and clean death. Betty Rowland, board member of Death with Dignity National Center, says that studies have shown that when asked, people express far more fear of suffering at the end of life than they do about dying with reason. She also says, for every one of the 91 terminally ill patients in Oregon who died with an assistance from a physician, thousands have had their fears quieted just knowing assistance would be there. Peter Rogatz, physician and founding member of Compassion and Dying in New York, member of the Committee of Bioethical Issues of the Medical Society of the State of New York, and member of the Ethics Committee of Hospice Care Network, says, are patients to shoot themselves, jump from a window, starve themselves to death, or rig a pipe to the car exhaust? All of these methods have been used by patients in the final stages of desperation, but it is a hideous experience for both patient and survivors. I believe that removing the prohibition against assisted suicide is likely to reduce the incentive for suicide. And another claim I like to make is that euthanasia will improve current healthcare systems. Linda Ganzini, Director of Geriatric Psychiatry at the Portland, Oregon Hospital and an Associate Professor at Oregon Health Sciences University, says that studies show that terminally ill patients in Oregon cared for has been improved since the passage of the Death with Dignity Act. The Oregon physicians' attitude towards the terminally ill patients accounts for the increase in care. There are those patients that consider euthanasia, but ultimately change their minds. Physicians having to deal with these types of patients have to expand their psychological knowledge as well as their physical knowledge. A study made in the early years of the passing of the law shows that 35% of physicians who cared for 21 or more terminally ill patients per year practice in the specialties of oncology, radiation oncology, pulmonology, and geriatrics. 27% have referred 6 or more patients to hospice care in the previous 12 months. Among the 2,094 physicians who cared for at least one terminally ill patient the previous year, 76% have reported that they have made efforts to improve their knowledge of use and pain medications in the terminally ill. So on to my inherency claim. I'm going to add on to Brittany's point where euthanasia being not legal is harming patients. People not being able to sacrifice themselves for their loved ones is wrong. Richard T. Hull, a professor emeritus of philosophy at the State University of New York at Buffalo, says, a soldier throws himself on a grenade to save his fellows. A pedestrian leaps into the path of a truck to save a child. Firefighters remain in a collapsing building rather than abandon trapped victims. These two are decisions to embrace death, yet we leave them to the conscience of the agent. He also says, why withhold from the individuals who clearly perceive the financial and emotional burdens their dying imposes on loved ones the power to lessen those burdens? And also allowing people the right to choose life-sustaining treatment undermines euthanasia. Robert E. Jones, the U.S. District Judge for the District of Oregon, says, current law outside Oregon does not presently permit an individual to consent to her own death. Nevertheless, the very same fundamental basis of the right to decide about life-sustaining treatment, respect for a person's autonomy, underpins voluntary euthanasia as well. And Peter Rogatz, I believe I mentioned him before, says, status quo forces patients and physicians to undertake a clandestine conspiracy to violate the law, thus compromising the integrity of patient, physician, and family. So on to my solvency claim. I will also add on to Brittany's previous experience. So Oregon is the main topic of this discussion, and they have implemented it, and they have really been successful. So if you previously, I said stuff about improving healthcare, and by Linda Ganzini, they have been, their healthcare has improved about, let's see, like the 2094 physician who cares for at least one terminally ill patient reported that they made efforts to improve their knowledge, so that helps. Linda Gazzini also said that many physicians reported that they had made efforts to improve their ability to care for terminally ill patients. She says that Oregon physicians have made care of the dying a focus of their professional education since 1994 and are more likely to refer patients to hospice care. So Oregon's experiences with voluntary euthanasia have shown nothing but improvement in the healthcare system. Thank you.